The relationship between medication adherence and mental health is a very, very important relationship, and one that is particularly problematic. I think it's problematic in all chronic disease states, but I think in mental health particularly so. Several reasons for that. One of them is people just naturally forget to take the medication. In some illnesses, there's significant denial about the illness, and there's a belief that they really do not need to take their medication. And the problem with that is if you miss your medication, depending on which one, for 1 day or 2 days, you may be okay. And then the person thinks, well, I really don't need these medications. And then they stop. And what happens is they relapse and they get hospitalized. So I would say the number one problem in terms of medication and mental health is adherence to medication. In my opinion, medication adherence needs to be monitored regularly. And what I mean by that is whenever I see a patient, I always ask the question at the beginning, are you taking your medications and are you taking it regularly? What I also do is I actually ask the patient to bring in their medications with them. I'm someone who uses and have for many, many years blister packs, and I will ask them if they could please bring in their blister pack so that I could see the blister pack when they come in for their appointment. Given the chronicity of psychiatric illness, and again, the importance of adherence to medications, I think one of the things that really does facilitate doing this is having blister packs. And the blister packs that are done at a pharmacy level, this is extremely, extremely important. And really, I think that that's the way that you can ensure the best adherence. It's also actually convenient for the individuals to have the blister pack. They don't have to fumble around, look at the different bottles. It's all there in front of them. If they travel, if they go away for the weekend, it's just one packet that they need to take with them. So I've always been a huge proponent of using blister packs. You know, I discuss treatment with patients options, and I talk about blister packs always from the beginning. And sometimes the reaction of the individual patient is, well, you know, then I don't have control and I don't have autonomy. And you know what I say, in fact, you do have control and you have autonomy. It just makes it much, much easier for you not to think about this. Ultimately, autonomy is there. You can have blister packs and, you know, not take your medications, but this is one of those factors that actually help and promote adherence. And I think actually it gives the individual more autonomy, in fact. On a personal level, you know, doctors, psychiatrists, either themselves or someone in their family, have medical problems, psychiatric problems. My husband happens to have high cholesterol, high blood pressure, and he is on multiple medications. And he was using a Dosette. I looked at it and I realized that, in fact, occasionally there was a pill missing. His vision is not perfect. A pill would drop on the floor. He did not notice that. So I think in terms of adherence, it wasn't quite as good as what I thought should be. So I actually suggested to him, I said, look, I really think that we should go to blister packs from the pharmacist regularly. And initially he said, no, I can do this, you know, myself. I don't have a problem. I said, you know what, let's just try it for a while and see how you feel about it. Convinced him, and he loves it. And we've been doing blister packs ever since. And, you know, he looks at it, you know, at the end of the day, and it's worked out really, really well.